Minister, on Budget Day you specifically referenced ambulance service improvements and indicated that there would be additional funding. On that occasion you didn't provide any significant detail. Can you identify for me if the Mid West region can expect to get additional resources for the recruitment of staff and for the provision of new vehicles? As you know, the Mid West region has had a very significant level of reconfiguration of acute services, and as a result of that requires investment in the ambulance system and ambulance service. It got widespread support at the time, that whole reconfiguration process, but it was accepted on the basis that there would be the consequent investment in the ambulance service. There is a problem, there's a shortage of staff and there's a difficulty with ambulances. Can you enlighten us, please, in relation to your funding of that particular need and when you expect that might happen?
Thank you. Minister. Question number 6.
A significant and ongoing reform programme has been underway in recent years in the National Ambulance Service, and considerable advances have been made in 2015. In particular, the opening of the new National Emergency Operations Centre in Tallaght and the establishment of the single national control system, which is now fully operational. This will help to achieve improvements in ambulance control and dispatch performance across the country. I also want to make the point that in recent years, the National Ambulance Service has changed and modernised its model of service delivery. It's no longer considered appropriate for an ambulance station to provide services only in its own local area. For this reason, the ambulance service is moving to dynamic deployment as recommended by HICWA, where all resources in a region are deployed across that region as a single fleet in response to demand. Among significant improvements to pre-hospital services in recent times is the Emergency Aeromedical Support Service, which the Government has now established on a permanent basis. Since its introduction in 2012, the EAS from its base in Athlone has now completed nearly 1,200 missions for time-critical and seriously ill patients, including those in the Mid West region. In addition, the development of the intermediate care service, which is based in Limerick, provides vital support to hospitals in the region, allowing patients to move to the most appropriate facility for the treatment they need. In 2016, we will build on these improvements through the provision of additional resources to the National Ambulance Service. While I have no doubt that the Mid West region will benefit from the additional resources, I am not in a position at this stage to give any specific details in relation to any particular region. The details of the plan for all HSE services, including the ambulance service, will be outlined in the National Service Plan, together with the allocation of existing and new resources. However, I can confirm that provision will be made for an increase in ambulance service staffing, intake, and also the expansion of community first responder schemes. Developments nationally will also be influenced by the National Ambulance Service Independent Capacity Review, which will help determine the current and future service needs. Areas being examined include staff numbers and skill mix, as well as resources and deployment locations.
Timmy Dooley.
Thanks very much, Minister. I note that you're not in a position to give any specifics on the Mid West. However, I can help you a little bit. In Clare alone, there's a shortage of about 20 staff, and the vehicles in some instances are quite poor and need replacement. So from that alone, I would ask you to use your influence in the development of the service plan for ambulance provision over the coming months to ensure that there is an additional staffing component of 20 provided to Clare, and obviously whatever other additional resources are needed in the Mid West generally. I do so, and I ask for same, on the basis that the public representatives and the people of this region have accepted in principle, and to a large extent in whole, the reconfiguration of services from places like St John's in Limerick, from Ennis General Hospital and Nina to the acute facility in Limerick. And that was a hard-won battle. It took a lot of convincing of people that it was in their best interest, and it was the best interest of patient safety and outcome from patients. But contingent on that was an expectation that there would be a fit-for-purpose ambulance service, fully staffed and fully provided for with appropriate ambulances.
Thank you, Deputy.
That hasn't happened to date, and I would appeal to you in a non-partisan way to ensure that those regions that have accepted the principle of reconfiguration get the appropriate investment in the ambulance service side of things.
Minister.
Just to confirm, the budget of the National Ambulance Service will be increased for next year. It was increased by about 5 million this year, and there will be additional new ambulances purchased, as there are every year. But how that is spread out, if you like, by region and across the country is really going to be up to the National Ambulance Service, and I'll be guided by their advice in that regard. I think, though, the point that Deputy Dooley makes is very valid and very well made, where reconfiguring has occurred, and we do want to do it in other parts of the country too. It's very hard to maintain public confidence in reconfiguring if there isn't a good ambulance service, and indeed it's important to improve ambulance services where that occurs. So I think the point that the Deputy makes is very valid for the Mid West region. It's also valid for the North East and the Midlands too, and certainly I'll take that on board.
Deputy Timmy Dooley.
Well, thank you very much, Minister, and I do appreciate your commitment to reconfiguration, because one of the big worries around the whole reconfiguration process was that the benefits to the system would be realised, and that the potential upside for the patient wouldn't, in terms of the provision of ambulance cover. I'm confident that you understand reconfiguration. I'm not entirely sure that the mandarins in the Department of Finance fully embrace and fully understand what's involved in that whole area. So I welcome your commitment to engage with the ambulance service. I had an opportunity with Deputy Pat Breen to visit that facility yesterday, and you're right, there is a fantastic service there. I fully accept and understand the dynamic deployment of ambulances. I think that's helpful, it's welcome, but it still requires a significant level of investment in staffing. Of course, it's often said by various different ministers there's an increase in the number, we intend to take on more people, failing to recognise that people retire as well. So it's the additional staff over and above what will be retired is important. And I suppose when it comes to referring to the vehicles, what's really needed is moving up the average age of the vehicle so that the fleet is more modern, and then you don't get the situations like what we've had in the Midwest, particularly in Clare, where one or two vehicles on a number of occasions have broken down, created all sorts of traumas for families, and in the case of one particular one, somebody died on the roadside as a result, I won't say as a result of the ambulance having broken down, but it was a feature.
Thank you.
And that doesn't do anything to add to the confidence of the whole reconfiguration process. So I welcome
the Minister now
your
to
comments.
conclude.
Thanks.